That has become as much as an inappropriate stent, inappropriate device, inappropriate molecule. It is going to be a big issue. If you feel it's not going to be issue, it is like putting the ostriches, putting their head in the ground. We are going to be exposed, and I'll tell you with pride, Thrissicon is a non-profit organization, and in last 7 years we have not taken a single pie out of Thrissicon. Even our reimbursement, petrol, gas, nothing out of the conference. Everything in the conference stays in the conference, and we show a balance sheet to all our sponsors, and we are the only, I shouldn't say we are the only, but we are one of the only organizers. For 7 years straight we refund the sponsors. Last year we had a 25% refund check going back to them because the money was left, and compoundingly that is why the money is coming back every year. So this is transparency. So coming back to the lecture, so patients will need to know why you are giving the drug, what is the role of action. And we are realizing that as we enroll our patient in various trials. How do you choose a drug? Again, so far we choose a drug because the pharmaceutical people or here or there told us. But now we choose a drug by attending these conferences, learning at trials, listening to Milan's lectures and many other lectures, and look into all these areas. So let's start with very basics, and I'll only keep it basics. That first thing is that over last century, it is a drug receptor interaction which has played a role in entire pharmaceutical industry. So what is a receptor? It is an entity that recognizes and binds the drug, transduces this information inherent in the drug structure to change various intracellular and extracellular function. What are these receptors? They are proteins, lipoproteins, glycoproteins, regulatory proteins, enzymes, etc. There are 4 major type of drug receptors, 1, 2, 3, 4. And I won't go in detail again. That's something we have learned in pharmacology lectures, we may have forgotten. But in basics, there are direct control ion channel, there are indirect coupling channels, there are direct control of effector enzymes, and there are channels working on drug receptors working on DNA transcription. Why they are important is direct control ion channel, the time scale of the action is milliseconds. In indirect coupling it is seconds. In control of effector enzyme it's minutes. And then DNA transcription take hours, into days also. So basic drug process is what is called as ADME process: absorption, distribution, metabolism, excretion. The ADME process goes through lots of biotransportations. Again, I'm just revising the basics, something which once you learn, you'll know much easier to ask your pharmaceutical representative, why is it superior? How many of you ask these questions on ADME? Let's be honest, how many? 2, 3, 4, 5, 6. Eventually we'll all ask them, okay, tell me about your molecule. How is it absorbed? What are the routes of administration? What is the superiority? And why it is important is the research is now going towards more and more of efficacious. As you all know, intravenous route is the most efficacious, most efficient, best way. But the commonest route is gut. But from gut and intravenous, lot of new percutaneous routes, intrathecal routes, which is less common, but inhalation routes are coming. So absorption involves the way a drug enters the body, passes in the body fluid, enters the systemic circulation. And factors affecting this absorption may be related to many things. Could be pH, GI tract, nasal congestion, etc. Once drug enters the body, there is distribution to major body compartments. Again, very basic concept. And then there is metabolism. And again, this is where the first step of metabolism in oral absorption mainly is where phase 1 is catalyzed by cytochrome P450, CYP450, which is a misfunction oxidase system, and it's a large family of isoenzymes. This is something we used to ignore. We used to not even understand this CYP450 concept. But now with lot of drug interaction, lot of side effects, early, delayed. We need to know little bit about side effects, about interaction, because we are entering the area of polypharmacy. Polypharmacy to the extent that we may end up writing 7, 8, 9, 10 molecules, and no doubt there is one area which is going to grow, not decline. And we have to understand a little bit about intestinal microorganisms, various pathways, and again back to first pass metabolism, which is drugs transported into the bile, passing into the intestine, go through the first pass through liver and get metabolized there. And finally, excretion of drugs. There is renal excretion, again with lot of diabetes, hypertension, renal insufficiencies, becomes extremely critical to ask about renal excretion, understand renal excretion, because we are killing patients. Lot of now data is showing combination of ARBs, ACE inhibitors, potassium retaining drugs, maybe potassium losing drugs leading to hypokalemia, hyperkalemia, and understand how it affects this. GI tract, same thing. Sweat is another area of excretion. Lungs and milk, less common, but there. Along with that, a simple concept of bioavailability as to various drugs, what is the proportion of administered drugs which are gaining access to the systemic circulation, how much of the drug is available, and once the drug enters the body, quite a bit gets destroyed in gut, some of it is not destroyed, is not absorbed, some is destroyed inside the wall, some by liver, and finally a small proportion enters the systemic circulation. In kidneys again, there is filtration, active transport, passive transport, various diffusion mechanism. Once the drug enters, the volume of distribution. Under ideal condition, drugs are considered to be distributed in one or more of its various compartments. And half-life and clearance, as you saw in the previous talk on antithrombotics, we have drugs with long half-life, we have intravenous cangrelor coming with a very short half-life. So these are concepts which are going to evolve to the degree where it will have effect on various disease states, effect on how you use the molecule, how you classify various drugs, and how you give it. Now, in disease states where we use the drugs, obviously we are using the drugs in disease states. Three areas we have to pay attention. One is chronic liver disease, again less common in our day-to-day practice, but more common is kidney disease. And kidney disease can lead to a lot of complications. Again, the protein binding, urinary pH, decrease in clearance, and prolongation of elimination half-life leads to toxicity, leads to complication. So this becomes very basic information you need to know, you need to ask, and most important, you need to read. Very rarely we read about the drug literature. We don't. We read little bit here and there. Time has come that we should, and I emphasize, we should read the drug insert. Just read it once, because there will be one case who gets a side effect, you are unaware, there is a complication, there is a lawsuit. And again, we have a talk tomorrow on consumer protection. So consumer protection is not banning lawyers. Consumer protection is going to be we improving ourselves. And drug dosing and dose interval. If you don't know, don't memorize anymore. Get it downloaded on your mobile phone. Nowadays I do check, we have outside our office a pharmacy with a pharmacist, and I call him sometimes. But now it is very easy, and you know what I type? I just go into Google like Dr. Milanbhai did with the trials. I found it so easy. Google half-life, Google interaction, boom, it will come up. Takes about 3-4 minutes. Heart diseases where we treat these patients, again cardiac failure, there is delayed incomplete absorption of drugs due to hypoperfused edematous gut. There is decreased hepatic metabolizing enzyme activity. Patients with heart failure, drugs should be given in low doses. Again, most of the drugs we try to emulate Western dosing, and we can get into trouble. Our patient's body size is smaller. They have cardiac disease. Creatinine clearance. We don't measure clearance. We should. Many laboratories have now started giving creatinine clearance along with the absolute creatinine. So start thinking in clearance terms. Half-life of drugs will be very important. That drugs with a longer half-life don't have to be given as frequently. And again, in myocardial perfusion, in cardiac thrombosis, is the drug reaching the target? Are we doing the right way of delivery of the drugs? Again, in intervention, again, time and again, you give streptokinase. You have to evaluate whether it has worked, whether the STs have come down. So the drug effect has to be seen in terms of efficacy. So to summarize, the key points are going to be that receptors are proteins, lipoproteins, glycoproteins. There is an interplay of multiple processes that govern drug disposition response, from body itself to multiple drugs going into the body together. And the mechanism controlling this are important. I strongly recommend start reading it. We have stopped reading this basic pharmacology. We should start reading, and that is where our pharma company friends should be encouraged. That next time you come, read little bit about your molecule and tell me more in detail. And I'm telling them now, and many of them are not sure. They come with this book, they open the book and show you pages. But when you ask them details, so encourage them. Tell them, go back home, you have more time than me. Read about the drugs, tell me the comparative analysis, tell me how this drug works in heart failure, renal insufficiency. In some instances, drug is metabolized by several pathways. We are finding that out. And if there are several pathways, we need to know again in those drugs, is there only one pathway, renal only, liver only, or there are two pathways. And several diseases can have major interaction. And this is something, believe me, I've started asking now. Before we were only interested in efficacy. We were interested in major side effects, but now I'm more interested in the pharmacokinetics, pharmacodynamics, and understanding the key points. Thank you very much.